So today I'm going to be talking about hyperbaric oxygen therapy for the treatment of autism. Hyperbaric oxygen therapy is definitely a passion of mine. I've been utilizing the therapy for over about 10 years now for various neurological conditions. And actually, before I begin, I'd like to get an idea. Is there anybody here who's actually had the treatment, either themselves or somebody in their family? Okay, one person? Okay, two person. Okay. Okay, so yeah, just wondering if anybody here has actually experienced the treatment. So again, I've been using hyperbaric for many years. Probably over the past, I'd say maybe 4 years, I've incorporated the use of hyperbaric oxygen for autism. So by combining it with some of the biomedical treatments that I do, the DAN protocols that I follow, I've seen some really, really remarkable, amazing results in my practice. I've been very blessed and honored to be a part of that. So today, I'm going to be talking to you about hyperbaric oxygen therapy, what it is, and what it can do for you and your child. We're also going to touch on some other conditions because there's so many different conditions that can benefit from hyperbaric oxygen, but of course our focus will be on autism. So thank you. Let's get started. So everybody should have a handout that was given out, and what I've done is I've just sort of outlined some of the technical stuff. I mean, there is some technical stuff. I'm not going to get too into it, but there is some basic things that you do need to know, which will then help you understand the other, some of the other information I'm going to present as it relates to autism. So I have outlined some of the slides on here, so everybody should have one of those. Okay, so hyperbaric oxygen therapy, what is it? Essentially, what it involves is the breathing of oxygen under pressure. So at sea level, we're considered 1 atmosphere, which is about 0 feet of seawater, and that's the pressurization that we're essentially, breathing air at, and that's considered normal, sea level atmospheric pressure. Anytime you go above 1 atmosphere, so 1.1, 1.2, 1.3, anything above, it's considered hyperbaric oxygen therapy. So basically what hyperbaric oxygen therapy does is when you breathe oxygen under pressure, what you are doing is you are dissolving that oxygen. You're actually using the pressure from in the hyperbaric chamber to dissolve the oxygen in the fluid compartments of the body. So we have oxygen all over our body, but it is limited in terms of the amount of oxygen our body can carry. When you introduce the oxygen in the body in a hyperbaric environment, you are now able to carry much more oxygen in your body because you're actually dissolving the oxygen in the blood system, in the lymphatic system, in the plasma. The plasma is the non-red blood cell portion of your blood, so you're actually dissolving more oxygen in there. And then for our discussion today, what's going to be important is the cerebrospinal fluid. This is the brain that's this is the fluid that surrounds the brain and the spinal cord. So we're increasing the amount of oxygen that's delivered within these fluid compartments of the body. So that's outlined on this slide. So normally when we breathe oxygen, this is what happens. It essentially travels down the bronchioles, goes to the lungs, and gas exchange occurs in these little sort of air sac clusters that we have in the lungs called the alveoli. So oxygen is basically transferred across the alveoli from the lungs into the venous system. So the veins come in, they pick up the oxygen, and then it leaves in through the arterial system. And that's generally how oxygen is transferred and basically enters into the blood circulation. So normally, gas exchange at normal atmospheric pressure, so here's where it can get a little bit technical, but I'll try and keep it simple. Remember, normal atmospheric pressure is 0 feet of seawater, so it's at sea level, and it's considered 1 atmosphere. So you have oxygen that is basically moving from the lungs into the blood vessels, and those little red circles there are the red blood cells, and they carry the oxygen. So that's normally what happens. Now we are limited essentially by the number of red blood cells that we have. So patients that are anemic, people that don't have enough red blood cell production, are not going to be able to carry as much oxygen. Therefore, you have the symptoms associated with anemia, the biggest one being fatigue. There is a small amount that's dissolved in the plasma, which is the non-red blood cell portion, so kind of the fluid. But again, there's only a small portion that's dissolved in the plasma. Most of it is carried by the red blood cells. Ooh, that hasn't done that before. Okay. Well, there you go. So, but this is, I think this is supposed to be for the next slide. There it's, wow, it worked. Okay. So, increased atmospheric pressure. It didn't work on my computer. It's working on this one. So essentially what's happening now is inside a hyperbaric chamber, now we're increasing the pressure. So I should be pressing that button right now. But what happens then is more oxygen moves into the blood vessel. So again, you still have the same number of red blood cells. It's not, we're not really looking at increasing the number of red blood cell production. What we're looking at is how much oxygen is now actually being dissolved in the liquid portions of the body. And in this example, it's, for example, the plasma here. So now the red blood cells or the blood vessels can carry more oxygen because more oxygen is now available to them. And we're actually using the laws of physics here in a hyperbaric chamber to dissolve more oxygen within this blood vessel. Now, one of the reasons that that's important, let's talk about injury, for example. So some people may know of hyperbaric oxygen therapy as used in sports injuries. So, athletes use it, they injure themselves, and so they use a hyperbaric chamber to speed up the healing that happens. In an area where there is an injury, so it could be a sports injury, it's also a brain injury, you have a lot of swelling within that area. And so when there's swelling going on, essentially the fluid in there, the swelling, is compressing the blood vessel, right? And so this is why we have a hard time getting some of the nutrients and the oxygen into the area, because the blood vessel is squished, essentially. Now, these red blood cells that normally carry the oxygen, they have a size to them. They're a cell. They can bend in half. They can fold over. They're really, really good at kind of being able to maneuver themselves so that they can get into these small areas. But there's only so much that they can do. And sometimes these areas are so squished, the blood vessels are so squished because of the swelling, that these red blood cells can't enter in there. So you're not getting enough oxygen supply into the area, and hence you're not getting proper healing within the area. Now, in a hyperbaric environment, what we're doing is we're dissolving the oxygen into the fluid compartments, the plasma, the non-red blood cell portion. This fluid can easily go in. It doesn't, there's nothing to bend, nothing to reshape. It's just the fluid that goes in. So this way, we're getting oxygen delivery into the area. So this is really important when it comes to healing an injury. So when we talk about a brain injury, for example, the longer the swelling stays, the more damage that we're going to get to these brain cells. Hyperbaric will reduce the swelling in the area, but also, is able to deliver more oxygen into the area and start healing those tissues so that we're minimizing the damage that occurs, for example, to the brain cell. So there are 13 primary accepted conditions where hyperbaric oxygen therapy essentially can be covered through insurance for the treatment of these conditions. And they tend to be more life-threatening emergency types of situations. So they include an air or gas embolism, carbon monoxide poisoning, probably the first-line treatment that's going to be administered in a hospital setting if you have carbon monoxide poisoning, a crush injury or something known as compartment syndrome or ischemic kinds of traumatic injuries. Decompression sickness, so a diver that gets the bends, and many of us are familiar with hyperbaric that way, is that we know that it's used for divers that get the bends. Healing in problem wounds, so remarkable for healing problem wounds such as diabetic wounds. In my practice, we